All right, I think we can go ahead and get started. Good morning, good afternoon, good evening, depending on your location. A warm welcome on behalf of the Boost and Curve teams to this webinar on responsive feedback, an approach to maximizing impact through testing and learning, aimed at introducing the responsive feedback approach and its benefits, as well as understanding its relevance in today's world and how it might help to overcome the challenges facing immunization professionals regarding vaccine hesitancy. We're going to get started in a few minutes, but first I'd like to just go over a few housekeeping items. For those joining us for the first time, welcome. The Boost community is a diverse and growing network of more than 1,600 immunization professionals from over 130 countries. Through our online platform, boostcommunity.org, we offer opportunities for our community to connect with peers, strengthen their leadership and advocacy skills, and grow in their careers. So I encourage you all to sign up and log in when you get a chance. You may use the raise hand feature if you have a question, or submit your questions throughout the webinar using the Q&A feature located at the bottom of your screen. However, I encourage you to use the chat box, which I see many of you have already started using, to submit your questions or make comments or respond to other participants throughout the session. And now would be a great time to introduce yourself and try out the chat function by sharing your name and where you're joining us from. And we'll be using this chat function throughout the duration of the session. And with that, I'd like to introduce a member of the Curve team who will be leading today's discussion. We have Dr. Rachel McLeod. Dr. Rachel McLeod is a research scientist at the Center for Community-Based Research at the Dana-Farber Cancer Institute. Her research focuses on communication inequalities with an emphasis on how technology and connected health may address or exacerbate these inequalities. Her recent work has focused extensively on creating and disseminating COVID-19 information to communities in both the US and globally, with an emphasis on promoting vaccine and preventative behaviors. She's been a member of the Curve Consortium since its inception and has played a key role in developing training and associated tools to educate diverse audiences about the responsive feedback approach. Thank you, Rachel, for joining us. And now I will turn it over to you.
Thank you very much. Hello, everyone. Thank you so much for joining us. Before we get started, I want to say a huge thank you to Boost for hosting us here today, working so closely with us to get this organized and to get this information out to you. So thank you to Boost and thank you to everybody who's attending today. As was mentioned, we are the Curve Consortium. The two key partners here are the Harvard T.H. Chan School of Public Health on the side which I work, and also MC Saatchi World Services. And we've got Lydia from that team here with us today as well. So we've been kind of the two key players of the Curve, working throughout the duration to really solidify this term of responsive feedback, to advocate for using the responsive feedback approach in a lot of diverse types of situations and organizations across the world. We've held global summits and communities of practice that have worked together to help to try out responsive feedback and really help us hone our craft here, and have given us some wonderful examples of how responsive feedback actually works in the field. So there's a lot of key players across the globe that we have worked with in a number of capacities, doing case studies, prior trainings in Nigeria for the Curve and its process. And so we're really excited to share a little bit more about that here with you today. We can go to the next slide. So we just wanted to do a quick poll, and I think Boost can help us launch this poll. Just a quick one first. Have you ever heard of the term responsive feedback? And please feel free to enter your selection. Okay, is there a way to display those results?
I might just give it another 30 seconds for people to participate.
Okay. Okay, it's about evenly divided. Okay, interesting. And yeah, so I think that what you'll find as we go through this presentation, and Dr. Vishwanath will mention this in a moment in his opening address, is that often you've probably been using a lot of components of responsive feedback in your work, but we have a process to make it more systematic and to rely a little bit more closely on the use of data and the smart use of data throughout that process. So I'm interested to kind of present this to you later today and see what resonates with you out of what we're presenting and what you've heard before. So we can go to the next slide. So responsive feedback, is how we've been conceptualizing it, is a philosophy that operates on observation, sometimes experimentation, testing, and improvement while you're in the field to identify factors that may increase program success and implementing these changes while the program is in the field. So what we really emphasize through this approach is to use data in a smart way that we get while we're in the field, see if things are working or aren't, try to identify what we assume is going to happen, and then use our actual observations to make improvements so that while we're still in the field, we can change the program and make it as successful as we can, versus a more traditional approach of gathering data at the beginning, maybe gathering some process data in the middle, and then looking at that pre-post data at the end, and then seeing that we didn't have the impact that we hoped. We really focus on making that a process that's ongoing throughout the entire program or intervention so that we can really identify those areas for success when needed. Okay, next slide, please. And so unfortunately, Dr. Vishwanath cannot be here with us today, but he has recorded an introductory message that talks about responsive feedback a little bit, goes into a little bit about its value, and sets the stage up for the rest of our presentation. So Dr. Vishwanath is a Lee-Kum-Kee Professor of Health Communication in the Department of Behavioral Sciences at the Harvard T.H. Chan School of Public Health. He's also the Professor of Health Communication at the McGraw-Patterson Center for Population Sciences at the Dana-Farber Cancer Institute. His work draws from literature in communication science, social epidemiology, and social and behavioral sciences, with the goal of using translational communication science to influence policy and practice. He has decades of work focusing on vaccine communication, works closely on addressing vaccine hesitancy across the globe. And so with that, we can go ahead and play Vish's introductory video.
Good morning, good afternoon, and good evening. My name is Vishwanath. I am a member of the faculty here at the Harvard T.H. Chan School of Public Health and the Dana-Farber Cancer Institute. I am one of the principal investigators from the Harvard side on this project called the Curve. You will be hearing from other investigators today, my colleagues from Sachi, and as well as my Harvard colleague, Dr. McLeod, Rachel McLeod. So what is responsive feedback? Why are we making you all come here to listen to us? Responsive feedback is a particular philosophical, theoretical, and methodological approach to promoting social change, particularly campaigns and other kinds of change in the development sector, but with significant practical implications or implications for or application for practice. The elements of responsive feedback will be very familiar to you. You will hear from my colleagues today, and as you hear their version and elements of responsive feedback, you will recognize most of them. But what we are trying to do is to provide an integrated framework to systematically experiment and learn from these experiments with elements of agility and changeability that responsive feedback can provide and improve upon other such similar approaches. Our goal is really to integrate different aspects of campaigns. Right now, we often see that the monitoring, learning, and evaluation components of an organization are sometimes different from and work differently from, say, the implementation group, and the funders are in a different place from the program. And our goal is to really provide this integrated framework where all these elements internally as well as externally come together and try to be on the same page to advance the agenda of the campaigns and ensure that it is moving in the right direction while the program is continuing to be operated in the field. I think that is very critical. And that's what responsive feedback is. Our team in the curve has been working on this for almost about 3 years now, and we learned a lot from it. And what we want to do is to share our lessons learned and train more people in using this approach, the responsive feedback approach. So you will hear a lot more details about this today, and what we are hoping is that this today's session will serve as a teaser, as an orientation for the trainings we will be offering in the next few weeks. So I look forward to seeing you all in the next few weeks at the trainings. Thank you so much.
All right, thank you to Vish. And as we're getting the slides pulled back up, I think Vish touched on a lot of really important things that we'll talk about today, particularly that bringing multiple people together at the table and hearing multiple viewpoints as you work as a team to both gather and make sense of the data that you're gathering. So before we get into it a little bit more, we just had one more poll for you. We're just curious, how does your organization currently use data? And so you can check all that apply. Is it for accountability? Is it to track your study progress? Are you looking at a specific research question and that's why you've how you structured your data gathering? You look at it after the fact, like gather process data to see how things went as planned or not after the end of the program. Or sometimes you've gathered data and they're not getting used. Maybe you've gathered a lot of process data but aren't able to use it all. And so you can select as many of those as you feel apply to your organization.
Great, we'll just give it another 10, 15 seconds and then we'll close it.
Okay, so it looks like a lot of organizations are using data for accountability, also to track study progress throughout, which is great to hear. To answer specific research questions, not quite as much. And it looks like about 28% said data is gathered but does not get used sometimes. I think that can apply in many different situations. Okay, thank you. So I think we can use that to head into our next slide. And so as we've kind of teased about before, responsive feedback is really hoping to help us get more value from the data and the evidence that we collect. So instead of just collecting for accountability, we want to change that into a learning and decision-making process where it's not you're held accountable for and might get in trouble for not gathering the right kind of data or not having the project go as planned, but we really want to switch to a more learning and collaborative approach so that we can gather this data and use it to help us instead of just holding accountable for whether the program worked or not. Sometimes data might have been used is collected but doesn't have actionable lessons attached. And one of our key tenets is trying to turn those learnings into action while we're still in the field so we can learn more from it. And instead of looking back at the end of the study, which I referenced before, we really want to focus on how can the data we've collected to date help our current performance, and how can we use it in the future? So how can we kind of instill these feedback loops to get the most out of our data as we're still in the field? And again, instead of just using data to track progress, we can take those same questions or think about how to add a few others to answer clear learning agenda. So we go in it, we look at the assumptions that we have about our program. Why do we think this program is going to work? What might not be working as well? What could challenge the assumptions that we have about that program? And then creating a specific learning agenda on how to drill down to making sure that our assumptions are correct and that our program is successful. And so we kind of take all of these things that we're used to doing in programs and try to make it an intuitive switch to learning and making decisions in a more systematic, structured way in which we have a learning agenda that can guide us as we use this evidence to test our process. Okay, next slide. And so as Vish mentioned, what we've noticed through our case studies and trainings is organizations get the most value from their data when they use it for learning and decision making, when they don't wait for a problem in order to learn, and when they build in ongoing learning from the start. And so I think that there are some simple ways that you can start to integrate data more for this ongoing learning, either from the start of the program or from where you are right now. I think the great thing about responsive feedback is it's a little bit flexible in both its philosophy and how you can integrate it into your organization. You could set up a whole new test and learn cycle, or you could be smart about the data that you're currently collecting and see how you can really feed that into these ongoing learnings. And so, as you can see in some of our pictures here, people coming together, people pausing and coming together as a group to kind of review this data is an important part of the process, both for buy-in, and this is from senior leaders down to those in the field who are implementing programs and collecting data. It might be from your close community partners. And what this gathering together can do is help people feel more part of the process and feel more engaged, and probably provide you with some insights that you might not have gathered otherwise. So that's why we really emphasize coming together and creating this culture of learning within our program and within the training that we'll provide. Okay, next slide. So this is just a brief introduction. In our trainings, we like to go through the curve process, which is our systematic way of learning through responsive feedback. And you see the C is that what I just mentioned, the convening stakeholders. And by stakeholders, we don't just mean funders and leaders of organizations, but as I mentioned, that whole diverse group that comes together and works on a project together. Then we want to uncover our assumptions. What are those things about programs that we think are working, but that we might not have really dug into to make sure that we're not just assuming something that it actually is true. For example, if you create communications for a program, are people accessing them? Are they in places where people can see them? Things such as that, or things that you can lay out in your process to make sure that you're on the right track. Once you've uncovered those assumptions, you can reveal these learning opportunities. And this is, like we mentioned before, setting that learning agenda. And so taking those assumptions and seeing what data do we have and how can we kind of test these out and make sure that we're on the right track. This sets us up to seek evidence. And often within this step, we really try to emphasize using data sources that you already have or that are easy to add on to. One of the things we've tried to emphasize through this process is that it doesn't take lots of sophisticated data or data analysis power to implement responsive feedback in your organization. Sometimes it might just be looking at attendance rates or number of brochures that were taken that you've put out. I mean, there are lots of different ways to kind of seek this evidence, and we go through that in more depth in our training. And then also last, evolving. And how do you take all of these steps, this learning agenda that you've put together, the data that you've gathered, and find out how to make these decisions on who needs to come together, look at this data, and make decisions on if program change is needed. And so there's a lot of factors that can be involved there, and we help you walk through them and think through, okay, how do we make this work? Next slide, please. So now I'd like to briefly go through a case study that we've been working on in our lab. And as much as on everybody's minds these days, we too have been working in the area of COVID-19. And this is a topic that lends itself very well to responsive feedback, because as the information and the science has kept changing, we have to be very agile in how we're trying to get information out and how we're trying to enter this space. So we're in real time trying to work, and still to this day, trying to make sure that our dashboard and all of the materials that we get out reflect the current science and what we've been learning from our many diverse community partners. Next slide. So what did we set out to do in the beginning? So when COVID first started in 2020, we came together as a lab and we were just thinking through, there's a lot of information coming out. There was a lot of uncertainty in that time period. And what we wanted to do was to create a simple resource that people could get critical information under these conditions of uncertainty. So with information and misinformation and disinformation, or faulty sources of information, all very rampant, we wanted to try to take what was out there that was evidence-based and science-based and really distill it down into a dashboard that people could come, particularly those in our partner communities in India and in the US, and so that we could have a place for them to access this information in a way that they could understand it. So we first set out to do this dashboard on our lab websites and use feedback from our community partners to evolve in real time as we went. So our current resources that we had at the beginning of this project, where we have 15 years of knowledge from our community, and particularly we work very closely with a community in Massachusetts, Lawrence, Massachusetts. And so we have those ties with a lot of stakeholders in that city so that we can more fully understand what the people within that community need, the types of information resources that they might most closely resonate with and pay attention to, and also the knowledge of our staff that work in those communities, both in Lawrence, Massachusetts and in our India Research Center. So we had all of this inside information that was coming in that we could draw from as a starting point. And then we also have our group knowledge of communication science and communication inequalities and how to construct messages successfully for different audiences. So these were kind of our starting points as we set up this dashboard. Okay, next slide. And as I mentioned, we rolled out dashboards across our lab websites. Vishwanath Lab and Planet Mass Connect are more US facing websites. And then the India Research Center is India facing. And we'd had a lab project called Project Sanchar, which was focusing primarily on journalists in India before COVID. And then we adapted our approach to put out more information specifically from Project Sanchar as the study went on, and I'll talk about that a little bit more in a minute. But initially, we had some frequently asked questions and myth busters, kind of in the form of text that we were trying to distill from places such as the WHO and the CDC into a really accessible format for our particular audiences. Next slide. And so as we went on through the project, we would meet frequently with our stakeholders, both in India and in Massachusetts. We had conversations with our community advisory board in Lawrence, Massachusetts, those stakeholders with the ear to the ground. Our community-based staff in both locations were listening extensively and talking to many different players in the local environment to see what was needed as far as information. And then we would have frequent internal team meetings to look at this evidence and try to synthesize it across these websites to meet the different needs of our communities. Okay, next slide. And so, I mentioned assumptions before, and I think when things were going so quickly at the beginning of COVID, our main mission was just to kind of cut through a lot of the information sources out there to provide accurate and reliable sources of information in an easily digestible format. But I think what sometimes tends to be the case with websites and tech-based resources is you have that kind of, if you build it, they will come approach. Let's put information on our dashboard and then people will come and get it and learn from us. But as I'm sure many of you know, sometimes it's not quite as simple as that. Sometimes people didn't have the resources to come to our website for resources such as, maybe it was access to internet, maybe it was language barriers, maybe it was just that we weren't able to publicize it in that format enough to get people to come directly to our website. And so this is when we really started to focus in on identifying boundary spanners or people that could help us disseminate this information, such as in Project Sanchar, journalists, other health professionals, community workers that maybe wouldn't direct people to the website, but that could take the website information and disseminate it among their target populations or among the populations that they work with. So it really sort of defined us going forward that it wasn't just enough to put frequently asked questions on a website. We really had to start looking a little bit more at our data and figuring out the best ways to disseminate it across these different population groups. Next slide. So we really started to dig into the evidence that we had access to. And sometimes we had to be innovative and think through what do we have access to quickly that could help provide us with this key information. So we used our stakeholder meetings that I've talked about before. We had internal connections with physicians and epidemiologists. We also released a very brief survey, what we passed around to physicians and nurses in India to see what types of topics they were seeing come up in the Indian context, particularly once they had reached one of their greatest surges. And we saw what kinds of information they needed. Did they need training videos and what formats? This was just an informal survey, monkey survey that we sent out through our contacts to try to get some sort of idea of how we could help there. We had easy access to our Google Analytics data. I think that this is a really helpful way to dig into who your audience is, how they're getting to your website, the top pages, which was really valuable for us since as our websites evolved, we started adding more and more pages with different material so we could really see what was resonating most with our target audiences. As we started putting things out on social media, which I'll get into in just a moment, we could look at that engagement data from the back end and just from the comments that people had left to see what was working best with different populations. We began to host different webinars, and we could look at the comments and questions that were going on in the chat during those webinars. And also we would have feedback forms attached on our website and to some of our social media pages. So this is evolving over time. We started with just the top with the stakeholder meetings, and since COVID has been ongoing, we've added these slowly. And as each time that we respond, adding a different way of getting out information, we try to also make sure that we have the feedback to make sure that it's working. And so this has been an evolving, ongoing process with many changes over time as we've tried to make sure we're suiting what our audiences needed at that point in time. And we did this using pause and reflect meetings very frequently with our internal staff, both here and in India. Sometimes we'd invite external partners as well, and we'd all look at some of these and what we'd heard from our friends and what we'd heard from our professional connections and try to say, where do we go next? Okay, next slide. And so in those beginning stages, one of the things that became the most clear to us and links back into that if you build it, they will come assumption was that we really needed shareable infographics. The long text wasn't working for the audiences that we were targeting in Lawrence and in some of these communities in India. What we really needed was pictures, less text, and clear messages that could get across all of these things that were coming out in the evidence space. And so you can see we have some pages, and what we tried to do here was make these so that they could be shared, they could be printed out and posted in community locations. We put them in multiple languages and different pictures that resonated with our different groups. So you can see we have some in English, across we have some in Spanish and Portuguese, and also in Hindi for some of our main content. And then we had some rotating GIFs as well. When we had more information, still to get it in those bite-sized chunks, we would have it in kind of rotating panes with the information to tell more of a story. Okay, next slide. And as you see as we added our Google Analytics and social media engagement data, we quickly realized that we needed to add multiple platforms. While we started off with Twitter as one of our first social media platforms, I think we quickly realized that you have a certain audience on Twitter, and we really needed to expand to other platforms to make sure that we were reaching as many audiences as we could. So we had our Twitter accounts across our different projects. We had our Facebook pages. We also started an Instagram account and then a WhatsApp page where we could share some of these infographics. Here on the far right, the two on the right, we also, through talking with our partners in India, produced a guide. And so this guide was more of a PDF for some of our India partners to take, and it had all of our infographics put together, as well as some of our frequently asked questions, in more of a one-stop guide in which they could pass out to their community partners. The guide was available online, and you can see here that we put little instructions that linked each infographic with ways to link it to Twitter and Facebook, on how to get it to WhatsApp. And so this was a way to get those boundary spanners to, maybe they already knew this information themselves, but what they could do is have an easy one-stop shop to share it across populations that might be more in need to learn more about vaccine efficacy, or to understand more about how to properly ventilate their home. So these were multiple different channels, and you can see here we even had some testimonials on getting the COVID-19 vaccine from some of the lab members. So we really tried to diversify, and this is an ongoing response to what we saw in the communities and what our data was indicating. Next slide. So we're still ongoing with that process. We're still using those feedback, those sources of evidence to work with our media channels. We're tracking it on the back end. We have definitely seen we get more traction with some of our infographics, and especially if they're animated. It really gives us insight on what people have resonated with so far, and all of that work is still ongoing. And so now, as we enter this current phase of the pandemic, as more countries get better vaccine availability, we can kind of take a look at that and what has worked and what hasn't worked, and hopefully have that as some of our evidence base to craft these messages that can reach people and encourage vaccination. So now I'm going to shift gears just a little bit and talk a little bit more about the Curve's purpose and how we're planning to set up this training for you. So we really work to democratize feedback across groups, as you saw, and we do this by convening practitioners to try to share best practices. We have our communities of practice. We have people active in the field that are really working together to learn about how to use responsive feedback and testing some of the tools that we've created and giving us that feedback in real time. We want to collaborate on practical ways to overcome barriers and make responsive feedback easier to do. One of the components of our research that has been spearheaded by MNC Saatchi is really looking at some of our partner organizations that have had these test cases or have been trying to conduct responsive feedback, and seeing what barriers they have faced when they're out in the field, be it organizational barriers of trying to get buy-in from everyone to do responsive feedback, to just not having time to analyze data. So we're trying to gather these challenges that people have faced in the field and, continue our work in a responsive feedback type manner to keep updating our trainings and our offerings to respond to challenges and try to think through how can we refine this concept and make it the best that we can as people try to implement it across the world. And as we mentioned before, showing how to harness these natural opportunities for responsive feedback. We want to emphasize that it doesn't have to be, reinventing the wheel within your organization. We want to find ways to help you put this process within your organization in an intuitive manner and to not be a drain on resources. We want to take the resources that you have to leverage them to best access this approach. And then finally, we've also offered technical assistance and trainings to enhance skill development. And so that's what we'll talk about a little bit more in a moment. Okay, next slide. So now we get to the training that we have been working closely with the Boost community for you. So first of all, when we offer this training, it'll be dates in October. We want to first sensitize participants to responsive feedback and its value. I know that we've seen that in here, people have heard of the term responsive feedback, and you might know some about it. We just want to make sure that at the beginning, we provide the value of responsive feedback and give you some kind of more cases that show how we evolve in context, and kind of set the stage for why it's a good practice for you and your organization to adopt, because one of our key features is making sure that we have that buy-in for learning-based organizations. And then also we want to provide practical skills and advice to integrate responsive feedback in organizations or projects. When we conducted our last training in Nigeria last September, we really found that people got a lot of value out of the live sessions in which we worked through case examples, we worked through the process of responsive feedback, and tried to integrate some of our current tools and thinking to let them apply it to case studies, and to their own work. And so you can see on the screen there that we have some of our resources, our website, which I believe was shared in the chat earlier. We have starting resources, but what we would like to do with Boost is to really make sure that we're working with these resources on problems that you're working on as you're on the ground in your communities. And so we don't just want to teach at you, we want to use this as a session to learn from you as well and give you some of these tools that we've developed. Hear your honest feedback, work together with you to think through problems that you're actually facing in the field. So we want to make this very valuable to you and not just another training on the shelf, but something that really works to problems that you're facing. And, we can workshop as a group, how to do these types of things. Next slide. Okay, so our curriculum, it'll be a 4 weeks curriculum starting in mid-October. And for each of these 4 modules, probably one a week, we'll give you a short informative video. We found that it often works best to go over the key concepts of a video of that training week in a video that you can watch at a time that's convenient for you. These won't be too long, but they'll just kind of give those key concepts to set the stage for our live sessions so that we can get the most out of the live sessions. Well, as I mentioned, practical worksheets that link to the videos that can talk about helping set the stage for responsive feedback, doing a resource inventory of the types of resources that you have, thinking through the stakeholders that you currently have in your own organization and how your project works and some of those assumptions tied to the project. And then we'll have a 90-minute each week online tutorial. And I think this is where some of the real value lies, where we can get your feedback and your opinions. And then you can hear from other organizations what they're working on in the field and how these tools and processes are resonating with them. And so we have it divided into one key lesson per week. And what we're hoping is that we can give these lessons in a way that you could start using them in your practice while you're still in the training. So, in the second module, as we're looking at that group of stakeholders, you can start thinking through, okay, who maybe do I need to bring to the table, and start working more closely with those people to see if there's a way that they can give you some insights that you didn't have before. Or maybe you'll be digging more deeply into your assumptions. All right, we have a current campaign in the field, but we haven't been getting the great results. What are those? Why are we thinking that this will actually work? Are there any things that we can probe on how this is working that maybe need a little bit more research before, or understanding of how we can best implement this in the field? And so we really hope to make this an interactive session with you guys, taking your questions and comments and giving you something that you'll be able to use immediately at the end of the program is our goal. Okay, next slide. So we're thinking about opening this for approximately 40 participants, looking for immunization professionals within the Boost community that work in areas such as health and vaccine education, community health, and health and vaccine promotion and outreach. We're hoping to really draw from Dr. Vishwanath's decades of work in vaccine hesitancy to really dig into some of these concepts within the session as well. He'll be there and he'll be one of the key leaders of the session. So we're really hoping to give some really good targeted advice with case studies that match to those situations that you might be seeing in the field. And so we're looking for people probably above entry level here, been at the organization for at least 6 months, because we want to have some sort of authority for some decision making or participating in the decision making process for everyone who attends. We'll have a number of different levels, and so it could be maybe you've been in the organization, you're kind of a mid-level position, up to senior members of the organization. So then we'll have these cross experiences, and we can see different perspectives on these organizations in the field. And then we would just ask that participants would commit to the full curriculum, all 4 weeks. So we feel like this is where you're going to get the most value as we walk through these different components of the curve process. They are also linked. And so I think that it really, the best value for you to see each component that we teach each week, but kind of get that understanding of how they can work together to best serve your organization. And so that's our overall training outline. And I think I see someone asking how to register. We'll get to that in just a moment. And I think our next slide is for questions. Yes. And so Boost team, I don't know if you've seen any questions that we can.
Yes, I know we had a few hands raised earlier, but I did see a question earlier. Someone asked if you could provide more context around the concept of the curve process and provide some additional examples of how it's used in real world.
Yes, and so I think that we'll really dig into that during the training. And so within the curve process, this is often used in many of our case studies around the world. And as you could see in the curve process, it's about building a foundation, first of all, of convening your stakeholders, of looking at your organizational resources, and then trying to move forward to look at different areas of your program that you might want to improve. And so, I think that there's many cases across the globe. If you look at our website, we have some quick and easy cases, because I don't know if I have time to get into more examples here today, but I know that the Curve website has been shared, and there are multiple in-depth case studies, not particularly on vaccine hesitancy, which is more what we'll use in this training, but it can get you a better idea of how people kind of aligned with the Curve process to think of learning questions and then gather data to try to answer those questions and make changes within their organization to improve their success.
Great. Maybe we can open up some more questions. If you have a question, feel free to raise your hand. Just got another question asking if the curve can be used in monitoring and evaluation.
Yes. And I think that people who are in the monitoring and evaluation field would find a lot of value in this process, because I think that they involve a lot of the basic tenets of the curve philosophy, is this ongoing monitoring and evaluation and making sure that those insights are used while the program is active in the field. And so I think that M&E plays a huge role in this process, and working with people who are maybe implementing in the field to try to have everybody come together to give these perspectives from an M&E approach, from an implementation approach, and try to bring all those voices together to best understand how to create change in an organization.
Great, thank you.
I see a lot of questions about registering, so I think we'll deal with those in a minute. I think we have some slides that will talk about that. Were there any other questions in the chat that you feel like I should address?
I think those were all the questions in the chat. If there are any more, like I said, feel free to raise your hand, or we can go over some of those training questions in the upcoming slides.
Great.
All right. So great. Thank you again, Dr. Rachel McLeod, for the discussion. I think it's a very relevant topic. And it seems like there is a lot of interest on the approach. So just a few steps to continue today's conversation. So we do have the link for the training application. As Dr. McLeod mentioned earlier, it's a 4-week training curriculum, and we will delve deeper into the approach and provide a sensitization and basic tenets of responsive feedback, along with some of the key lessons that can be applied immediately. We also have a link to join our Telegram channel. So we use this channel mostly to send reminders and updates about courses, trainings, and other events going on in the Boost community platform. So I encourage you to join the channel if you haven't already. Also, we encourage you to take the post-webinar survey. So this allows us to gather your feedback from this webinar, and we can improve future offerings based on that. So very important. And as always, if you have any questions, feel free to reach out to us at info@boostcommunity.org. Last but not least, we wanted to share an update on an upcoming course that we have. It's a life course immunization course. So Boost, we are partnering with an organization called Wolf City Learning. Their flagship program, it's more well-known, it's Immunization Academy. And we're developing a course on life course immunization. So it's a 7-part learning series that will introduce the topic to its members and guide them in developing their own life course immunization programs. It's based on the Project ECHO model and grounded in learning science, and will center around sharing some of these best practices and using case-based learning. We'll also use subject matter experts to share knowledge with participants through mentoring, guidance, and didactic education. So participants who attend all 7 of these live sessions and complete all the coursework will receive a certificate of completion, but please note that there are limited spots available, so be sure to register early. And I believe my colleague MJ shared the registration link in the chat box. Also a reminder that the deadline for registration is Friday, September 3rd. And with that, I'd like to thank everyone again for joining in this webinar discussion, and I hope you all have a lovely day. Thank you, everyone.